Ladies, welcome to One Simple Step today. I'm so glad that you joined me. This conversation is going to be great. I'm with Jennifer, and she just delivered twin girls about a month ago. And she had a singleton pregnancy 5.5 years ago with her first daughter. So today, let's talk about all the differences between a singleton pregnancy and pregnancy with twins, because there are a lot of differences. So let's jump in. Jennifer, welcome to today's show.
Hello.
Why don't you just share your pregnancy story and the delivery, especially the last few weeks, and what progressed with the delivery of your twins?
So with the twin pregnancy at the end, we'll just kind of talk about that. Around 32 weeks, right at my 32-week appointment, I was diagnosed with preeclampsia, which I had a feeling was coming. It's relatively common with twin pregnancies. And so what that means is it means that there's a couple things that are required to be considered to have preeclampsia. You have to have protein in your urine, and high blood pressure, and swelling, which that could be swelling in your legs or swelling in your belly. It could be swelling in your face and hands. It could be just swelling. For me, that was swelling in my legs initially, and then it worked its way up my legs, and I actually had swelling or edema in my belly underneath of my belly button. Which was crazy because I was like, these are the worst stretch marks I've ever seen. And my doctor was like, that's not just stretch marks, that's edema. You have really bad edema in your belly. I was like, oh, okay. She's like, it's because you have twins and you have preeclampsia. And I'm like, okay, all right, cool. So with that being said, with the preeclampsia, I was like, oh no, this is terrible. This is so scary. I'm going to have problems and it's going to be a terrible thing. And she was like, well, yours is still mild. Your blood pressure, it was still just kind of running right at 140/90 or 140/90 to 95. So I never broke 100 on the bottom blood pressure, and I've never broke 145 or 145 on the top. So it's considered mild for a really long time. And she's like, we're just going to watch you. We're going to keep doing weekly appointments. And if it goes up any at all, just so you know, you're going to have to go out of work. And I was like, okay, it'll be fine. I'm a trooper. I'm going to push right through this. It'll be great. But at some point, obviously, so the other thing that she did when she saw that it was turning into preeclampsia, she wanted me to do these 24-hour urine collections, which we can have a discussion about that later, but it's awful.
Okay.
And it's really, really, really awful in the middle of an ice storm because you don't have power. Really, really awful.
Oh boy.
Which you don't expect in Oklahoma in October, an ice storm, but it happened. We survived though. So preeclampsia was the kind of the confounding factor. That was the limiting term to my pregnancy. What ended up happening as far as the actual delivery, what happened is I went in for my appointment, my regular appointment at 35 weeks. 35 weeks and 2 days is actually when it was. And the nurse, she greeted me, of course. Then COVID, like you have to call the doctor before you go up. So you call the doctor, tell them you're there, and then they meet you at the door. And she meets me at the door, and she's like, "Oh, how are you doing?" And I was like, "Oh, I'm okay. I'm still pregnant. I'm doing okay." And I keep waddling on in. And I was like, I think the girls have dropped because it did look like they had dropped. My belly had dropped that week. And she's like, "Oh, that's good." And of course, she had me she weighed me, and I was 207 pounds. And I'll remember that for a while. And then she's like, "Okay, well, now you can go pee in a cup." And I peed in the cup, and she had me get dressed from the waist down because it was gonna have a check. So Dr. Hall checked me, and I was dilated 3 centimeters, and I was completely effaced. So she's like, "You're in a good place. We're going to send you downstairs for your fetal non-stress test." And I was like, okay. She's like, "We're going to do our labs just like we have been every week. You're going to do another 24-hour urine collection." Yay. And we're going to do another a CBC and a CMP to watch my basically what that means is to look at my blood counts,
Mhm.
to make sure that my platelets were okay because I was having trouble with my platelets. That's part of what's to come. And to make sure that my liver and my kidney function were okay, which is also part of what's to come.
Right.
Um, so up until that point, they had been doing these labs every week or during the non-stress test, and they would just draw them then, and it would take a day or two for the results to come back. But I think Dr. Hall must have known that something was different, because she had them process them in-house instead of sending them off to the lab. And while I was doing the non-stress test, she got the results back, and they were not so great. My platelets had dropped way, 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 way down. They had been outside of the range of normal, but it was not crazy until that point. And they dropped down to, I think, 80, I think is what I got to that morning. And then my liver function test had been riding slowly, trending upward, to the edge of border of normal, at 34 weeks, and then at 35-week appointment, it was outside of the normal range on my ALT and my AST.
Mhm.
So she called Laura, the nurse, who I had a weekly date with every Wednesday. And she's like, Laura, it's time. You need to go. You need to tell her today's going to be the day. And so I found out that it was going to be the day. And I was like, okay, this is okay. It's going to be okay, because I had my steroid shot at 32 weeks. So I know that hopefully that my baby's lungs would be okay.
Uh-huh.
That's kind of on preemies and with twins, because most twins are born a little earlier than singletons. If your doctor thinks that you might deliver early, they're going to give you a steroid shot. Actually, it's a series of 2 shots, 24 hours apart, to make sure that their lungs have developed.
Uh-huh.
And so basically, that was the day.
Right.
And then, as far as the day itself was concerned, basically, so they broke my water, started me on Pitocin, broke my water, and then things progressed. I ended up getting an epidural.
Uh-huh.
With twins, that's normal. If you're going to have a vaginal delivery, it's normal for them to give you an epidural, even if you don't have the pain medicine placed inside of it.
Mhm.
They do want the epidural to be there in case if baby. So for my doctor, what she wanted, if baby A was head down, then we could try for a natural vaginal delivery.
Right.
If baby B, after baby A went out, remained breech, the plan was to pull her out, and that's what ended up happening. They do put pressure on your belly afterwards to try to get baby B to flip,
Uh-huh.
and some people are able to have the baby flip, but mine didn't.
Okay.
And that's okay. It all worked out.
Yeah.
So basically what had happened is we had just talked, I just was talking about my labs and how that my liver enzymes had elevated and that my platelets had decreased. And then also I was anemic, which is a sign my hemoglobin had dropped, which is a sign of anemia initially. And then with those 3 factors together and the fact that I had preeclampsia, it meant that I had developed something called HELLP syndrome.
Mhm.
And that's spelled HELLP,
Uh-huh.
not HELP. And what that is, HELP syndrome is kind of a rare form of severe preeclampsia, or it's thought to be. And it stands for hemolysis, which is the destruction of the hemoglobin or the red blood cells. Elevated liver. So the elevated liver enzymes, the ALT and AST, for me, those were both elevated. They ended up going, the border of normal is around 40, and mine ended up the very next morning, when they drew them again, they ended up at 240.
Woo.
So it's like crazy.
Yes.
Yeah. And then the last part is for low plate. LP is for low platelets,
Uh-huh.
which mine ended up dropping from all the way down to 80 or 80,000.
Mhm.
So I think 120 is the borderline of normal. And so, yeah.
That makes sense.
And where that kind of plays a role in my delivery is the fact that my platelets were low. Is platelets are what causes the blood to coagulate or help part of the coagulation cascade. And during my delivery, when my placenta didn't want to separate from my body, and they had to scrape it out, it ended up causing me to hemorrhage. And so that is how HELLP syndrome ended up making a pretty big difference in my delivery story.
That makes sense. So you knew about preeclampsia from 31 weeks or so.
Yeah, I think 31 weeks.
You were diagnosed with HELLP syndrome at what point? That day of delivery?
That day of delivery.
Okay.
Yes, ma'am.
Okay, so it progressed to that point.
Yeah, and I think that that's pretty common. Once people move from preeclampsia to either severe preeclampsia or, in the case of me, HELLP syndrome, that means it's delivery time, because it becomes a little more. There's a mortality risk that is a lot greater with HELLP syndrome or with severe preeclampsia than with mild.
That makes sense.
In the case of me, and probably most twin pregnancies, or even just most preeclampsia pregnancies, it's a balance of trying to see how long that the baby can stay in versus mom's body holding up.
Right.
And so for me, that tipping point happened, and then they got that baby. They get the babies out immediately.
That makes sense. Yes. So again, it was a balance. Was there anything that you did intentionally from, say, week 31 to 35 when you delivered to help keep your blood pressure down or keep the swelling decreased? Is there anything the doctor told you to do?
So when I went off of work, initially I was on quote unquote modified rest. I never had to do hospital bed rest, which I was very, very thankful for. But I was having, so I did stay home from work, and my job, what I assigned myself as my job, was that I needed to rest at home. So when I was at home, I needed to sit in my recliner with my feet up, most of the day. I would get up for a shower a day. I would get up to do like one activity, something, like go for a walk. I say a walk, not like a long walk, but up and down the cul-de-sac with my 5-year-old, like maybe 2 blocks. Once a day, I would do that, and then go to the bathroom and take a shower, maybe to make dinner or put one load of laundry on, but that was it. Only one store if I went out for an errand, one store only, not anything more than that. I started limiting my salt intake, because a lot of times when you eat salt, it just, the way it works is it makes you retain water worse. And physically keeping those feet elevated, I think, makes a big difference. I also wore compression socks. And those are hard to get on, especially when you're super pregnant. But they made a big difference. Yeah, that's where the 5-year-old comes in really handy, or your husband.
Yes,
whoever.
Yeah, those were helpful for me too in my pregnancy, and I think they get overlooked quite often, but I was just curious if you did use the compression hose.
Yeah, I did that. Actually, I started the compression socks before I went out of work, because I was having some swelling issues starting maybe 24 weeks or so. And it's just, you just get uncomfortable. And it's not uncommon, but the compression socks at least keep it moving, and then keeping your body moving helps with that too.
Right. Definitely.
But there's a balance.
And did you take your blood pressure regularly, or did you
yeah.
log that also? I know that a lot of times with COVID and a lot fewer in-person doctor's visits, that's been a good, helpful tip for pregnant women, is having a blood pressure cuff at home as well.
Yes, I have a blood pressure cuff at home, and I was checking it multiple times a day, because I was so afraid of that either the bottom or the top number going above what my marker was. If it went over 100, then I was to call labor and delivery. And I as a pharmacist, I knew just enough to be dangerous to myself, if that makes sense.
Yes.
And that I was so worried that I was going to have a complication. I was scared of the preeclampsia developing into something more serious, like a severe preeclampsia or a HELLP syndrome.
Mhm.
I was so afraid of it that I was checking it regularly. So 5 times a day probably. And I just put it in my phone. On the iPhone app, you have the health little heart. You can type it
Yeah.
in, and I was doing that.
That's great. That makes it a lot easier too. And I know for women, if we can give more concrete details to our doctor, then that
They
helps
listen to you
understand what's
more.
going on too. Yeah, they really do. Again, it goes back to advocating for yourself and being aware, educating yourself, and then speaking up and making it as clear as possible so that they can help you as well. So, and again, with preeclampsia, ladies, the standard is you don't want your blood pressure higher than 140/90 or going 10 points higher than your norm. So your norm may be different. And that's why you really want to know what's my norm so that I can see a change. So again, in that communication with your doctor, that's important to do. And again, like you said, there's lots of apps to use or on your iPhone, record it too. So those are a couple of tips.
You could write it on a piece of paper too, but I'm never good enough at keeping things where they need to be. And then I didn't want to have to get up and walk around to find a piece of paper. I was, it was easier just to use the app on my phone.
Yep. Yep. So ladies, I hope that this has helped you out a lot just with some of the questions about preeclampsia and the HELLP syndrome, because that's important to know what's going on with your body and the changes and kind of some of the questions to be talking to your doctor about. So that's wonderful.